Well, 350 million people worldwide suffer from depression. It's the #1 cause for disability, according to the World Health Organization.
A Renton woman tells us that after a lifelong struggle with depression, she has beaten the odds because of a medical treatment. Hannah Kim shows us the piece of technology that many have never heard of.
It's called Transcranial magnetic stimulation. It was FDA approved in 2008, but one local doctor says it's just starting to grow in popularity because of more studies showing its effectiveness and more insurance companies willing to cover the treatment.
I didn't want to get out of bed.
Jude Main says she feels stuck in a fog.
With my depression, it got so bad that like I said, I slept most of December.
No motivation, no happiness.
Why does everybody else think I'm dead?
No laughter.
I have had suicidal thoughts. The commuter train came by really, really fast, and I used to think about that every morning. You know, I could just get out of my truck and walk in front of that train.
That's been her life the last 20 years. Hoping the next pill will fight the urge to take her own life.
6 different antidepressants over the last 20 years.
Judy says each medication would eventually lose its effectiveness. Doctors say to understand Judy's struggles, you have to understand her brain. This is a normal brain. The yellow means the frontal part of the brain is activated with glucose and oxygen. Compare that to a depressed brain.
Look at that, no activation at all.
Psychiatrist Kalyan Dandala with Associated Behavioral Healthcare is Judy's doctor.
Knowing her history, I was at a loss.
Hello.
So Dr. Dandala tried something new with Judy.
Any changes in sleep?
She's about to get Neurostar's Transcranial Magnetic Stimulation, or TMS.
We'll go right on top of her head and align it.
Here we go.
And this is when the tapping begins.
It reminds me of maybe a dentist drilling, but it doesn't hurt. Yeah, it doesn't hurt at all.
You can think of the device as a condensed MRI machine. The square device on her head is stimulating the left side of Judy's brain that's dormant. Is it like shock therapy?
It is nothing like shock therapy. Shock therapy is something that they put you in sedation and you actually create a seizure in the entire brain.
TMS instead sends magnetic stimulations to awaken neurons.
What we're using is your body's natural serotonin to communicate with the front part of your brain.
I could actually fall asleep during this.
Patients have to sit through 19-minute treatments 30 different times. On this day, Judy was on her last treatment.
About the 3rd week was when things really started to lift.
Judy says it's saving her life.
Now I have good days, and I don't even think about not having good days anymore.
And people are noticing.
People at work are impressed with the improvements in my mood.
Well done.
Dr. Dandala says the vast majority of his patients see improvements.
They're getting off from 3, 4 antidepressants down to 1 or none.
With about 37% of patients actually beating depression for good. So is it a cure?
Let's track this for another 40 years, and then we'll call it a cure.
You're making me work as a checkout lady, and my starting salary is bacon.
For Judy, she says it feels like a cure. That fog she lives in is finally gone.
It's like somebody had come in and wiped away the fog that I was looking through every single day.
Judy is now done with her sessions. Her doctor says she appears to be among the 37% of patients who is able to beat depression. For others, Dr. Dandala says they may have to come back in a year or 2 and get the sessions again. Neurostar's TMS is covered by most health insurance companies now, including Medicare and Medicaid. Guys, back to you.
Wow. Boy, if it works like that.
If it works for her, good
Yeah,
for her,
and off all the medications, what a relief that would be. And look how happy she was. I mean, you can just
that's the
see
whole
it on her
point.
face.
Yeah.
Yeah, that's great.
Well, today, House